Good evening, plastic surgery aspirants, INISS NEET aspirants, and DocTutorials students. Today, we are going to share the success story of Dr. Anshu Saini, who has recently cracked the INISS NEET plastic surgery and has secured AML 3. Welcome, Dr. Anshu. Welcome. A very
Thank
good
you, sir.
evening. Yeah.
Good
Uh,
evening to you
so,
as well.
yes, thank you. Today, you're going to share the pearls and the bits of gyan to our plastic surgery aspirants, which will help them to crack the INISS NEET plastic surgery entrance exam next year. Okay. Let us start with Dr. Anshu. Where are you from? Where did you do your undergrad and post graduation, Dr. Anshu?
So I'm from Mohali and I did my MBBS from GJS Faridkot and my MS from GMC Patiala, sir.
Okay. So, how did you get into the concept of plastic surgery as your favorite super specialty subject?
So I took MS General Surgery, getting inspired from a plastic surgeon in my UG college.
Great.
But then during my MS days, I was quite tilting towards gastro and onco. So I spent some time over there as well,
Okay.
reading about them. But yeah, and that is the reason that I chose to give NEET because I was not sure about the branch.
Yeah.
And somehow it did not happen. So I spent 2 months, around 2 months in my SRship in surgical oncology, and that was what I was aiming for. And then
Okay.
I realized that I am not really into taking the stuff out. I want more of like getting things back to normal.
Okay.
So that is how I chose to give plastic surgery in this April session, sir.
Okay. It's very interesting, Dr. Anshu. You are right. Like many people I've seen when they do surgical oncology, only they develop the interest for the plastic surgery because they realize the reconstruction process is much more tedious compared to the extirpation process.
Yes,
And
sir.
okay, so when you have decided to go for the INISS NEET, when did you start your preparation, Dr. Anshu?
So Jan 1st of this year.
Okay, fine.
Itself. Yes,
So,
sir.
what are the books which you followed, and how did you get into the pattern? What was your secret for success? Like, kindly elaborate for our students.
So I tried watching the videos in the first place, but I think videos are more of like the crux of the entire books. So you don't really get the complete thing. And being on class, like being in general surgery, so we don't have really much knowledge about plastic surgery.
Yeah.
So I could not just get basic understanding of the subject from video. So I chose to study from Grabs and Smith.
Okay.
So in January itself, sir, I completed my first reading of Grabs and Smith,
Nice.
and then I watched the videos again. So it made the things easier because in videos, in your videos, like there are only tables, which are like the crux, and most of the questions are from the tables itself. So I chose to do it like that, sir.
Okay. Okay. So, did it speed up your process, or how did the videos help in understanding, or retaining, or going through? In which, how did it really help? Like, if you can categorically change it, whether in understanding or revising or understanding, which is the important topics, how did it help you?
So for me, personally, I think in the retaining and the revising parts, the videos helped. They
Okay.
helped a lot because I was reading from the books only. I had highlighted the important points and I was going through that. And after doing those chapters from the book, I was seeing the same videos, same topics videos. So.
Okay. Okay. Nice. So, how did the grant test help you in your preparation? How frequently you are giving, or did you not give, or what is your recipe?
Sir, I'm not much of a test giver, sir,
Okay.
because getting a low rank in tests or not getting the marks up to my expectation used to bring my morale down. So it used to affect my studies. So I gave a few tests in the beginning, but near the exam, sir, I did not give the tests. I
Mhm.
just concentrated on revising my notes and watching your videos, sir, in 2x. There are hardly like 59 videos, sir,
Yeah.
so it takes you 3 days if you watch 10 videos, 20 videos per day. So it takes you 3 days to revise them
Okay.
wholly. Yes, sir.
Okay. So that's how. Okay, fine. Yeah, we got here many views on how our videos can help. This is on different view because most of them told we went through the mock grand test a lot and after that, not securing marks, we went to the videos and then we went back. But I'm also happy that a different take on our curated content is there. Nice. For the benefit of our viewers, can you tell me, like, out of the 80 questions, how many did you attend? And how many did you
I
leave, especially in plastic or in general surgery? Roughly.
uh, Before attempting the exam, I had seen your video where you were saying like in recent years it has been difficult to even qualify the plastic
Yes,
surgery part.
yes, yeah,
So
yeah.
I decided that I'm not gonna go like all questions. I'll just
Okay.
attempt the questions that are required. So I
Okay.
at least qualify the exam. So
Yes.
this time sir, I attempted 73 questions, sir.
Superb. Okay, okay, nice.
Yes,
This
sir.
73 has been a magical number because all the rank holders have told 71 to 73. Only one guy told I went full for 80. Okay. So which did
Yes.
you find as very difficult? The general surgery part or the plastic surgery part, or which one is the most trickier part?
So general surgery, they are limited topics only that they ask in INI. So that was easy. I think I left just one or two questions from general surgery, and two, three questions were in plastic, which I had no idea.
Okay.
So I did not touch those questions, and the doubtful ones also I chose not to just over attempt this time. So.
Nice, nice, nice. So next question is, after getting qualified for this, did you attend our mock session? Because we conducted a mock session. I didn't get the some during the mock session I didn't get the faces to see. So that's why I don't know whether you attended or not. But a couple
So
of
I
people.
wanted to, but somehow I missed the mock
Okay,
interview
that's
session,
fine.
sir.
That's fine. No problem.
Yes.
Just share your experience. How were the mock interviews? Did they use the pictures and instruments, or did they right away go for the questions? How did the interview work out for you?
So this time they had not shown us any photographs of instruments
Yeah.
or imaging or anything.
Okay.
So basically, in most of the vivas, there were six vivas in total. So they asked us, what all procedures have you seen in plastic surgery?
Okay.
So I had just one month of rotation during my JR-ship. So I had seen some basic procedures like skin grafting, local flaps, tendon repair, liposuction.
Okay.
So I told them about these topics only, and they asked me questions based on that. So.
Okay. Okay. So were any questions on brachial plexus or cleft palate? What was asked?
So mostly tendon repair, reconstruction, extensor tendons, flexor tendons, pulleys, and different techniques of repair. So, and in brachial plexus injury, they had asked me where how will you approach a patient of brachial plexus injury, and one more question on facial nerve palsy, sir, and the approach to a patient of facial nerve palsy, babysitting procedure, phases of uh, steps of skin uptake,
Update.
skin
Yeah.
grafting uptake, so differences in STSG, FTSG, basic questions, flaps.
Most of
So
most of these were like from Graben Smith and covered only, right? It didn't
yeah,
look like
yeah,
out of the bounds or something very practical surgical steps like that. Most of the things were how
no,
to
no, no.
assess, and you were able to answer. Yeah.
Yes, sir.
Yeah. So my next question is, what would you advise to your juniors? What is the time frame they have to fix preparation? 1 year, 8 months, 6 months? What do you suggest them?
So I will suggest that if you are aiming for the INI, sir, take an early decision, choose your branch, and stick to it. And I started studying from January of this year. So after doing my duty till 4, I used to come back, relax for some time, and start studying at 6, around 6 p.m. in the evening.
Okay.
To then 6 to 2 were my fixed reading hours. I used to try to work, but some days it was not possible. But then again, it's about small steps, sir. Even 2 hours of study per day or whatsoever, you have to cover up your syllabus. So you just can't let a single day go by without reading anything. So just maintain consistency. Be sure about the branch, and if you really like plastic surgery, sir, then you can put in the long hours, and it will make your life easier.
Yeah. So yes, viewers, here we are having the pearls from our Dr. Anshu Saini, who is AML till third rank. And I would like to tell her, like, how do you summarize the whole journey? Like, it's nice to hear that our videos have helped her. It is a hard work, it is a hard effort, but we are very happy that our platform's content has helped us in securing, or was an instrumental in her journey to secure the plastic surgery seat. Yes, Dr. Anshu, like in plastic surgery, which is the field which you like? Now let us go beyond it.
So
Because like
I
most of the time I say plastic surgery is again a glorified broad specialty field. There are five more fields. There is an onco reconstruction, pediatric plastic surgery, which deals with cleft lip and palate. There is a hand, brachial plexus and microsurgery, and a hand transplant surgery. There is an aesthetic surgery. There is a burns and general plastic surgery. So, what is your call? What is your attraction, Dr. Anshu?
So first, when I used to read about local flags, in theory, I didn't get like how to move tissues from here to there. So that is something interesting. Initially, I like to work upon that, and I think the next is I like the replantation, and replantation really excites me. And other facial reconstructive surgery. So ear, I think ear reconstruction. It is something
Okay.
of a magic itself.
Okay.
Very creative thing. So
Nice.
these things excite me. So
Okay, yes, Dr. Anshu, you will get your call while you're doing MCH. Like you told when you started your general surgery, you initially had a drift towards SG and finally you came back. Similarly, now you are liking replantation, hand surgeries, etc. While doing your course, you will invariably get to know what is your calling, what is your soulmate in plastic surgery. So I once
yes,
again wish you all the best, and I once again thank you for sharing the knowledge and how our platform has helped you in securing. And I also keep my doors open, like in your plastic surgery career, if you have doubts like what to choose, how is in practical life as an aesthetic surgeon or as a replantation surgeon or as a burn surgeon or as an oral and maxillofacial surgeon, our platform and myself, we are ready to help you in your journey. Also, I will happily be seeing you in one of the conferences somewhere as a plastic surgery fraternity with both arms wide open. We welcome you to this plastic surgery fraternity. Congratulations, Dr. Anshu Saini. Thank you for joining us. Thank you.
thank you so much, sir. Thank you.